Okay, hi everyone. Tonight we're going to be going over our last lecture, which is the comparison of roles in health and wellness services, which is a very long title for this very, now I realize, interesting lecture. This is the one that you guys requested, really to compare and contrast different healthcare services and healthcare providers. And it's been interesting looking into it. So we'll get started. The the ones I chose to focus on are chiropractors, athletic trainers, personal trainers, massage therapists, and exercise physiologists, and specifically looking at what is the definition of their job, what sort of professional associations do they have working for them, organizing them, lobbying for them, what are their educational requirements, and licensing and certification requirements. Just for the sake of simplicity, I mainly focused on how their roles are defined within California, because a lot of these are state specific and not really well defined at a federal level. Looking at California law, and this is going back to our lecture the other night about the Business and Professions Code, in which we as physical therapists live under, they do define who is a healthcare practitioner for the state of California. Um, on this list, it includes acupuncturists, chiropractors, occupational PT, respiratory, speech language pathologists, and a few other ones. And anyone who is on that list of healthcare practitioners is subject to licensure and regulation under the Division of the Healing Arts. So we are regulated by the same laws. The providers that are not included in this healthcare practitioners are athletic trainers, and I put an asterisk on here because there's legislation currently being debated regarding if they will or will not become healthcare practitioners for California. We'll get more into that later. But personal trainers and massage therapists are not under these healthcare practitioners laws. Um, for anyone, though, no person who is not licensed as a physical therapist or physical therapist assistant can claim that they provide physical therapy services. So those terms are called, what we call, their protected titles, meaning you can only use that title if you've met the licensure requirements, the rules and regulations according to this article. And also that we are the sole providers of those services. So these are protected words underneath the California law. So starting out with chiropractors, going from their own definition in their professional association, chiropractic health focused on disorders of musculoskeletal and nervous system and the effects of the disorders on general health. So that sounds a lot like we do. They do further categorize it a bit more to say most often treating neuromuscular complaints, but not limited to back pain, neck pain, joints, arms, legs, headaches. So their definition of what their profession is somewhat in line with how we define ours. They are designated, though, as a physician level provider in many states and in the federal Medicare program. However, the California designates them as healthcare practitioners, so they are in the same category that we live in for the California laws. But like for Medicare, they are considered a physician level provider, which is why a chiropractor can write a referral or sign a plan of care for physical therapy. Um, the American Chiropractic Association is a very, very large, very powerful association with a lot of lobbying power. They are very vocal and protect their members very well. Um, their vision is to leading a modern movement of chiropractic care based on higher standards and a focus on patient outcomes. And when you go to their website, you can really see this. They definitely promote the benefits of chiropractic care as far as like what sort of outcomes they get for their patients and how they are good providers based on those outcomes. And this is a model that actually we are attempting to mimic a little bit with physical therapy with an emphasis on showing our outcomes that we provide for our patients, showing our value for care. For certifications and licensures, these are both governed by the National Board of Chiropractic Examiners. So this is somewhat similar to our physical therapy. Or sorry, now I'm forgetting it. FSBPT. Oh, I'll look it up. But basically, the governing body that regulates the National Physical Therapy Exam. So the educational requirements in order to graduate and sit for the board exam for them is a doctoral degree. There are 3 or 4 year graduate programs. They have to have a minimum of 4,200 hours in the classroom, laboratory, and clinical internships. They also do have post-professional residencies for advanced practice, similar to how we have the residencies and fellowships for physical therapy practice. In order to be licensed, you have to pass a series of 4 national board exams, including a practical exam, which is governed by the National Board of Chiropractic Examiners. And what's interesting is they kind of have like elective exams you can take as well to get a certificate, and they have a physiotherapy exam. Their physiotherapy exam is a 90 multiple choice question exam, which covers a lot of modalities, but it also covers topics on gait, movement patterns, muscle imbalance, physiology, cardio, pulm topics, and neuro rehab. So again, even if they take this exam, they cannot legally say in the state of California that they provide physical therapy services. That's a protected term. They cannot say they are a physical therapist. That is a protected term. But they can say they can offer some of these services, and they can point to the fact that they have taken this exam. They are legally allowed to provide these services within California, such as eSTEM and doing, strength training and conditioning training. So in addition to passing the 4 board exams and a practical exam with an option of a physiotherapy exam, then they have to be licensed within the state. So similar to physical therapy, after we pass our exam, then we have to be licensed within the state. For California, our Practice Act is pretty similar to theirs, with the addition that they can use vitamins or food supplement for nutritional guidance, use of x-rays and diagnostic ultrasound, and treatment modalities. So that goes into the use of eSTEM, ultrasound, hot packs, ice packs for treatment. They also have annual continuing education requirements. Athletic trainers. These are the 2 definitions here are from their professional association as well as the Bureau of Labor Statistics. So the sorry, I just had a brain fart. I use the Bureau of Labor and Statistics for the definitions for a lot of these because it could be consistent across all the professions. Not everyone had a definition, so I pulled their definition so that we could be consistent across all the different healthcare services. But both of these definitions for athletic trainers are fairly broad. Athletic training encompasses the prevention, examination, diagnosis, treatment, rehabilitation of emergent, acute, and chronic injuries and medical conditions. So they do not say specific to sports or activity, as well as the definition from the Bureau of Labor Statistics also does not specify, with athletic activity following, before, during. And within their own vision for their professional association, it also is a very loose definition as far as them being a healthcare provider, and also being recognized as part of the interprofessional healthcare team. This is really mimicked in a lot of the language that we are currently seeing in California, with them trying to define a scope of practice. For the education requirements currently, the minimum requirement to become an athletic trainer is a bachelor's degree. However, there's a big push to move within their association to move to a master's degree, and what they say is within the next several years. They do also say on their association page that over 70% of athletic trainers currently have a master's degree. So this is, it shouldn't be a big jump. It's very similar to us going from the master's degree to the doctoral degree, but they're going to be moving from the bachelor's to the master's. And they also do have post-professional residency programs, which they say are on the rise. And these can be, doing sports medicine specific, basically emphasis in different areas of athletic training. In order to become certified as an athletic trainer, according to their association, you have to have a graduate of bachelor's or master's degree, and then pass a comprehensive test administered by the Board of Certification for Athletic Trainer, and then you do have to meet ongoing continuing education requirements. So if you are an athletic trainer, you have met their educational requirements, you've taken this exam, and then you continue to maintain that certification through continuing education. California is the only state that does not have currently any regulations regarding athletic trainers, meaning we don't have an athletic training licensing board, so there is no legal defined scope of practice, there is no education or certification regulations within California, and essentially there's no way for if someone in the public was to have an issue with the athletic trainer to make it a complaint to the state. This clearly the athletic trainers would like this changed so that they are defined within the law, and that there is some sort of licensing or certification process. And the biggest problem right now, so we have currently being debated and discussed, like today it was debated and discussed in the assembly, is Assembly Bill 3110, and it's the Athletic Training Registration Bill. And you can even look this up and see what the definition, how they define all their scope of practice. But the biggest complaint coming from the associations that are in opposition is that it's a really broad scope of practice that would essentially allow athletic trainers to treat any injury or illness, and would make athletic trainers another physician extender, meaning they would answer only to physicians by basically having a physician sign their plan of care, but there is no other limitations, they would be essentially less regulated than physical therapists because they don't even have that direct access aspect with the 45 days or 12 treatments, anything like that. Within the language, it just says, as long as a physician has signed off on my plan, I can see this patient either for preventative kind of care or after an injury due to an athletic event. Like I said, it was currently today being discussed in the assembly, and they have said they would like some revision before it goes to the Senate floor. This is strongly opposed by the California Physical Therapy Association, Occupational Therapy Association, Nurses Association, Association of Physicians Assistants, and it's been a fight back and forth for many years now. I did speak to someone here at the House of Delegates who is active in the legislative arena, and he flew from Florida back to California just to sit in the assembly and speak to this bill. And what he was telling me, because I was saying, it seems kind of crazy that everywhere else has license and certification. Shouldn't we? It seems like we should have this for the athletic trainers. It would make me feel more comfortable if they were regulated. How come we can't get this something to go through? And he said that, he was in agreement. The goal would be to have an athletic training licensing board. However, the issue is that they continue to propose such a large scope of practice that there's no way that we can uh, speak in favor of it. So it just keeps going into a back and forth, mainly because of this scope of practice issue. Massage therapists. So their association didn't have a definition for their profession, but for the Bureau of Labor Statistics, massage therapists treat clients by using touch to manipulate the muscles and other soft tissues of the body. With their touch, therapists relieve pain, heal injuries, improve circulation, relieve stress, increase relaxation, aid in general wellness of clients. So again, sounds very similar to some of the things that we do. This is also, I put in the Northwestern Health Sciences University's definition of what massage therapy is, because I also think it's a good definition, but it does sound similar to what we as physical therapists say we provide. The American Massage Therapy Association is a relatively small association. They don't have a vision listed, but their mission is essentially to serve their members and advance the art, science, and practice of massage therapy. Primarily, it looks like they offer, continuing edge, help with certifications, and general business plans and monitoring the profession and where it's going. The biggest thing is that with massage therapists is whether or not in their state they're certified or licensed. So a license basically, when it's administered, the individual cannot work unless they are licensed by the state, and the licenses are usually a little bit more rigid as far as what are the rules and regulations. They need to have a licensing board. They need to have their own defined, articles which describe their licensing board and the licensing requirements and any punishment for breaking those requirements. A certification is not quite as stringent, but it does identify who has met a recognized standard for that profession. And then because they've met that recognized standard, they are able to use that protected title. So the California Massage Therapy Council, which is underneath our Business and Professions Code within the Healing Arts Division. So they're housed within the Healing Arts Division, but they're not a healthcare practitioner. They do have, so that council will provide a certification to a massage therapist if they have met the following criteria. They've completed curricula in massage and related subjects, which is totaling a minimum of 500 hours, and they specify that 100 of those hours have to be in anatomy, physiology, contraindications, business ethics. They do need to pass a competency assessment examination that is defined by the council, and then they have quite a bit of continuing education requirements with 30 hours per year up until they reach 250 hours of continuing education. So once you meet those criterias, you can be defined as a certified massage therapist or certified massage practitioner, and that protected title cannot be used by anyone else. And I can say I do massage therapy, but I can't say I'm a certified massage therapist. And I think what the big part of this is like, why does it matter? If you can practice massage without having this protected title, why would you need this protected title? Well, a lot of now, to get a business license, to have a massage business, they want to see that you have this certification. So it's become tied to the business practice of massage therapy. Personal trainers are not regulated by any federal or state laws, but the definition of what they do, again, sounds very similar to what we do: instruct, motivate individuals, exercise activities, including cardiovascular, strengthening, stretching, and in their definition, they work with people of all ages and all skill levels. But like I said, there is no federal or state laws that regulate personal trainers. There's no education requirements, no certification, no licensing, no protected titles, which means anyone can say that they are a personal trainer. There are certifications, though, that give a little bit more weight to personal trainers. So these are some of the most common ones. Ones that, we often see within the physical therapy realm, even, is people who get their CSCS. So the National Strength and Conditioning Association does a certified strength and conditioning specialist. And the reason why this one's a little higher on the list is because the requirements to do a CSCS, you have to have a bachelor's degree from an accredited institution. You have to be CPR certified in order to sit for that exam. So this one's held with a little bit more weight than some of the other ones that are the certified personal trainer, so CPT, which again is not a protected term, but if you were to apply to a job, let's say, here's a good example. So you put out a call or a job request that you would like to hire a personal trainer for your clinic, and someone comes and they bring you their resume and they say they are a certified personal trainer, you would want to ask, well, where did you get your certification from? Because they should have either the American Council of Education, National Federation of Professional Trainers, National Exercise and Sports Trainer Association, some accrediting body that gave them that certification, and they should have proof of certification. So there's these ones, I didn't necessarily see a hierarchy. They're just sort of different programs, but most of them offer online courses, and then you take an exam to get your certification. Last but not least, exercise physiologists. So exercise physiologists, as defined by the Bureau of Labor Statistics, develop fitness and exercise programs that help patients recover from chronic disease and improve cardiovascular function, body composition, and flexibility. Again, sounds very similar to what we as physical therapists do on a daily basis. There is no education requirements, certification, licensing, or protected titles for exercise physiologists. However, most people won't claim to be an exercise physiologist unless they have graduated with a bachelor's or some sort of education in that topic. It's not like a commonly, in my mind, a commonly used term. More likely, people would say they were a personal trainer. But again, there's nothing stopping you from saying you're an exercise physiologist. The American Society of Exercise Physiologists is what looks to me a relatively new professional organization, and they're committed to the advancement of exercise physiologists as healthcare professionals. So it was really interesting going through their website and kind of what their aim is and what they're working on right now, because essentially, let me see if I have it on now. Okay, let me go back, sorry. What they're really working on is increasing accrediting education programs in order to better prepare people for their board certification, which is a board certified exercise physiologist. So currently right now there's 4 accredited programs through this society that say, yes, these are exercise physiologist programs that prepare you to take our certification. And in order to take that certification, you have to have an academic degree. It could be a bachelor's or a master's, but with an emphasis in exercise physiology, exercise science, kinesiology. You pass their exam and you're a member of their association, and then you can use this term, a board certified exercise physiologist, or an EPC. Again, that's not a protected term. But they are definitely striving to grow their profession and aim it more as like they are healthcare providers. I guess legitimize it a little bit. So this is kind of someone we want to keep our eye on as far as the next in line that may want to get kind of a piece of the pie of the patients that we work with, or a piece of the reimbursement that we work with. So in summary, looking at physical therapy in comparison to these other services, professionals, providers, physical therapists, we do have the doctoral degree requirement right now, but you know that the asterisk is because if if you had a bachelor's or a master's that grandfathers you in. Right now, we do have a protected title. We do have to be licensed within the state of California. It doesn't matter about the certification because that's a lower level, so our license trumps any certification. Chiropractors also have a doctoral degree. They do have a protected title, and they're licensed. So we're sort of on the same playing field in California, other than they have those few extra things that they can do as part of their practice. Athletic trainers. Right now, the educational requirement is a bachelor's degree, but it looks like it's quickly moving to a master's degree. They do not have a protected title, nor do they need a license or certification. But I put an asterisk on that because I have a feeling even within the next couple of months, or at least the next year, this may change. Massage therapists, they do have a requirement set by their council, with it being about 500 hours of curricula and massage. They do have a protected title. They aren't a licensed practitioner within the state, but they do require a certification in order to get that protected title status. And like I said, it mainly gets tied to also being able to get a business license for massage therapy to open a business. Personal trainers and exercise physiologists live right now in the unregulated, unrequired zone. And these are the ones, we kind of have to keep our eye on because as they grow as a profession, and you can mainly look to their professional associations for what their strategic plan is, they can be the ones that are coming up kind of like the athletic trainer as far as attempting to move within what we consider our scope of practice. The question always lies, should we be working with all these different providers that are providing services in health and wellness? Do we need to be collaborating or do we need to be competing with them? There's not clear answer. It's true that a lot of the competition comes from fighting over reimbursement, access to patients, being able to practice at our full scope of practice and not have that impeded by another healthcare practitioner. But I would say, really looking for areas in which we can collaborate. And in my mind, the ideal way would be creating more of a system where the correct practitioner sees the patient at the correct time. So there are certain times where it might be more appropriate for a doctorate of physical therapy to see a patient. But maybe that patient, after they're more stabilized and on their own program, can transition into a personal trainer relationship. Someone who's followed by a personal trainer or an exercise physiologist, depending on what that patient needs. I also think there's room to collaborate with the athletic trainers. I don't see this as a zero-sum game, and we really just need to figure out a way to get the scope defined so that it doesn't feel threatening to our profession. And same thing with chiropractor. I don't see it as a zero-sum game. I think there's room in the healthcare field for both of us. We just have to know who should be seeing who when, and it's not an easy answer. I say it's not inappropriate ever to have a patient seeing chiropractic services and physical therapy services. Or if they fail with chiropractic, coming to physical therapy. If they fail with physical therapy, going to chiropractic. Some patients prefer certain types of therapy services or wellness services or prevention services versus another. So the best thing we can do is keep conversations open with these different health and wellness service providers so that there are opportunities for our patients and we're not shutting ourselves off from each other. Okay, and that's my references. So thank you guys for listening to this online lecture. I know it's not as exciting as seeing me in person, but I really appreciate your flexibility. Just as a reminder, your business plans are due on Tuesday night by midnight, and I will be reading those on my way back to California. And then on Thursday, we will have our final exam when you get into class. It's 30 questions, heavier. It's comprehensive, but it's more heavily weighted towards the last 2 to 3 lectures, basically everything after that second quiz. I did post for you guys as well those examples of different billing and coding practice things, so that helps to prepare for the exam. And then we will have on Thursday, after you take your final exam, your business pitch presentations, which I'm so excited about. So 5-minute pitch presentation, and I will post the order of those, of who's going to go when, probably, I don't, tomorrow sometime. So I will see you guys on Thursday. Please feel free to email me. I know some of you guys have been sending me your business plans or financial plans. I'm totally fine with that. Email me. I will take a look at them if you have any questions or concerns. Okay, thank you and have a good evening.